The only way to get a handle on your healthcare spend is to completely redesign the health plan to incentivize health and not popping more pills. It's the real reason your corporate wellbeing efforts aren't showing an ROI. Even if you have the greatest wellbeing strategy with the cool apps and wellness challenges, if you don't subsidize functional and integrative medicine that will reverse disease and get employees off the drugs, you're just shooting yourself in the foot. It's admirable you want to encourage employees to live healthier lifestyles, but let's face it, the business case for well-being was all founded in the need to reduce healthcare costs. You can dress it up in better engagement scores and higher talent retention and attraction, but a well-being program that's disconnected from the healthcare strategy is not addressing the far bigger business challenge of out-of-control healthcare costs. Employers are putting far too much time and attention on the basic healthcare plan and the pharmaceuticals it covers. The balance is all wrong. It needs to be flipped. Maybe you've got some point solutions in place, perhaps a diabetes reversal program, maybe one for digestive health, maybe one for autoimmune conditions, a musculoskeletal solution, but they're all communicated as part of the well-being program and optional, part of lifestyle improvement rather than disease reversal. But then if you're having some symptoms or you've already got a serious condition diagnosed, you're pointed to the conventional health plan, which only covers conventional doctors handing out pharmaceuticals and ongoing testing, maybe some surgery. The naturopath your friend recommended is not covered, nor the high quality supplements you've heard that can be really helpful. Now, sure, employees may be a little upset if you reduce coverage for all those conventional doctors and pharmaceuticals right off the bat. So you need to communicate really well and make sure you have those solutions in place that will actually get them well and that they're easily available. Maybe you have some point solutions already rolled out and it's just a tweak in the communications and education, or maybe you don't have the budget or the bandwidth for all those point solutions. I'd argue you can't afford not to offer the alternative ways of tackling health. The good ones have really clear and validated ROIs getting the employees off the pharmaceuticals, and many of them have direct-to-consumer offerings, so you just have to provide the recommendation, and that's where the correct budget lineup comes in. So for $200 a month, you can get an employee that's diagnosed with a chronic condition that's currently spending tens of thousands of dollars on doctor's visits and pharmaceuticals, and you can get them really reducing their reliance on the conventional health plan altogether, claims going down to zero. On the alternative point solution, they're going to get a detailed set of labs, they're going to get a coach, some high quality supplements, an app to help track all of their details, and they start to feel better. Most of the point solutions can be covered by a health savings account, or you can invest in a lifestyle or flexible spending account platform that has a lot lower compliance requirements, and it's a notional setup, so you're only paying for what an employee is using, and it can be as restrictive as you like as to what they spend the funds on, but you can give the employee to choose which point solution, for example, is going to work best for them. What it looks like in practice is really going to depend on your current setup, whether you're insured or self-insured, whether you're utilizing ICRAs today, how much of a wellness program you have in place already. But I can tell you that just tweaking the basic design of your current healthcare plan to cover GLP-1 drugs or not, or finding a higher quality network, messing around with co-payments, none of that is going to move the needle on your healthcare costs. The message is still going to be sent to employees that if I'm sick, I need to use the regular health plan, find a conventional doctor, get some drugs, and that's just the way it is. We really need to change the paradigm. Until next time.